Hi, I'm Dr.Sandip Rane. I'm a cardiologist. I'm practicing in Mumbai for the last 37 years, and I've got my hospital, which is also 37 years old. And we are now a tertiary care hospital where we treat cardiac patients who come with serious problems. And in the last 4 to 5 years, we have almost done 1,000 bypass surgeries. What is the main problem? I think it comes to our lifestyle. A very poor lifestyle is responsible for increasing number of heart patients. So I think the primary and the most important thing is lack of physical activity. Today we are all sitting at home. We are either glued to our cell phones or we are glued to our television sets. And outdoor activities are negligible. Today, a large number of gyms are coming up, but unfortunately, the gyms are not equipped with the right equipment. We have gyms without defibrillators, and therefore, quite often we hear of certain instances where fit people, while walking on a treadmill, suddenly collapse. And they have no first aid or CPR given to them because the primary response of a cardiac emergency is lacking. People are not trained in doing a CPR of a patient who's lying down over there. I think if there are gyms, then there should be certain criteria to categorize them as A-class gyms or B-class gyms. A-class gyms which have everyone, all the people in the gyms are trained for giving CPR or having a defibrillator in the gym itself. Outdoor games, in fact, I think probably the burden of studies on young children is competition is very high. They are more into their books, into their computers, into their cell phones. Cell phone, social media is a great distraction for the generation, and therefore their cardiovascular fitness has come down. We find that there are fewer and fewer people participating in sporting activities, outdoor activities, which will actually give them cardiovascular fitness, which can be assessed by their heart rate increasing beyond, say, 125 beats per minute for, say, 15 to 20 minutes every day. That is what will give you a reasonable amount of cardiovascular fitness. The second most important thing is your diet. I think we are not very particular about what we eat. We are all in a hurry to finish off our lunch, have a fast grub. The fast foods which are coming up around the corner, I think we should have more of home cooked food which has a lesser amount of saturated fats, less amount of fried things, less amount of cholesterol, and I think having a good diet is very important. Intermittent fasting is you should have a gap of 14 hours between 2 meals. Then it can be lunch and dinner, or best is say you have your dinner at 7 o'clock and then you have your breakfast at 9 in the morning. So you go off to sleep so you don't feel hungry. If at all at say 10, 10:30, 11 you feel hungry, you can have a glass of chas, buttermilk, or maybe an apple. But 14 hours gap allows your system to settle down. It allows the metabolism to normalize, and it's such a simple way to implement and follow. And intermittent fasting not only helps you in cutting down your weight by a good amount. In fact, diabeticians today are saying that do intermittent fasting and we can, a little bit of dietary modification exercise, we can show you reversal of diabetes. I can add reversal of heart hypertension, and we can also probably add, with more data coming in, reversal of heart disease. So I think diet is something very important and a very simple thing to follow. Intermittent fasting, in our day-to-day practice. Please follow it, it will help you in a big way. Stress in other days. Today, in fact, recently we had a pandemic of COVID, and I think it has created a large amount of stress in a number of families, right from actually deaths occurring in families. There are many families who have lost their jobs. And so many of my patients who come and ask them, what are they doing? We have no job. And in fact, recent data from Gujarat shows that the incidence of heart attack in youngsters in the age between 18 to 40 has gone up significantly. Now, we don't know whether it is attributed to COVID or any other cause, but I think most probably this data is post-COVID. So it is likely to be because of the infection, continuing inflammation, and that is causing the arteries to get choked up, and therefore probably the younger generation is more likely to is more susceptible to heart attacks and infarcts. Diabetes is one of the very important factors. Hypertension and diabetes. I think these are one of the most important risk factors which need to be controlled, and the two diseases are known as silent killers, and therefore it's very important to identify them at a very early stage and get them treated. You can prevent it. Today there's a lot of, as I had earlier mentioned, that lifestyle modification can help you in delaying the onset of diabetes, delaying the onset of hypertension, and even reversing your diabetes and hypertension. That brings us to, Doctor, should we do regular health checkups? Regular health checkups are useful in certain patients who are high-risk patients. Like they have got people who got family history of having heart disease, or patients who got family history of having diabetes or hypertension. They need to undergo a regular checkup and find out whether they are prone to develop diabetes or hypertension. Cardiovascular fitness, as I said earlier, today we have a lot of equipment, gadgets. People are having their Android watch and Apple watches, which give you heart rates, and heart rate monitoring can be useful because it can pick up early irregularities in your heart rates, or if it's going slow or fast, and then that would be an indicator that go to your nearest doctor and get us a check in case it is an abnormality. So if you have chest pain, don't think that it is gas trouble. It is said that there are more tombs because of gas trouble than actually heart attacks. So therefore, it is, if you are 40 plus, if you have chest discomfort, it is safer to go and get a ECG done from your neighboring general practitioner. If there is anything abnormal, you can take measures to prevent problems. But if the ECG is normal, go ahead and enjoy your life. Thank you.